Hello, and welcome to the recording of How to Get into Medicine. The majority of this video is going to be exactly the same as at our live event, and it's the recording of those speakers. But we thought we'd take the opportunity to correct some of the technical errors that happened on the night. So we will hear from Jude Marshall, one of the GPs, who unfortunately wasn't able to speak last time. With that in mind, I'm also going to repeat my talk from the night, so this will be not quite what you remember, but hopefully much of the same content, and will be helpful to anyone who wasn't able to make it along. I'm Callum, I'm one of the trustees of You Can Be a Doctor, and we're delighted to be bringing you a wide variety of speakers tonight, with the support of Dundee Widening Access to Medical School Society, Medic Insight Glasgow, and Medicine Outreach Glasgow Widening Access Initiative. All of our speakers tonight are current doctors or medical students, and the main aim is to give you a flavour of what being a doctor is like. I know the pandemic has made it much harder to get work experience and to access the support you would normally have, but we're hoping to put some of that right today. The first half of this event will be talks from current doctors. Firstly, I'll tell you a bit about my life as a junior doctor, then we'll hear from Morven McElroy, a consultant in medicine for the elderly, and Jude Marshall, who will tell you about being a general practitioner, or GP, the kind of family doctor you've probably all been to. Then, after a short break, Callum Livingston, a medical student in Dundee, will tell us about writing personal statements and interview technique. With the deadlines fast approaching, this should be particularly useful. Finally, we'll hear from medical students at each of the Scottish medical schools about their experience of university. Throughout the night, you can type your questions into the chat, and we have people there to answer your questions. This session is being recorded, but the chat will not be, though your username will be visible to others if you post. We'll also pick some questions to put to our speakers at the end of the talks, so you can stick around for that if there's something specific you want to ask. Given the nature of the event, we can't answer questions about individual circumstances in great detail, but you can always email advice@youcanbeadoctor.co.uk, and we have a team of doctors and medical students ready to help. We've never run an event like this before, and everything from talking to a camera to the live stream technology is new to us. There might be some hiccups as we go on. If you do notice anything, pop it in the chat and we'll do our best to fix it. So our first speaker tonight is me. I'm going to tell you a wee bit about my life as a junior doctor. I think it's fair to say it's a bit of an odd job. It's not something that you really fully understand what it entails until you're doing it. And it's not the best thing to say at the start of a talk where I'm about to try and explain that, but hopefully by the end you'll have a better idea of what it is I do. I guess I should start by explaining what kind of context we work in. So every doctor has to go to medical school. You have to get your medical degree to become Dr. Cruikshank, for example. But after you do that, there's still more training to do. And actually, to become a consultant, that could even be another 10 years or more of training. The important point though is that you're getting paid after that point. So once you've earned your degree, you are working in employment, but also in training. In the UK, the first 2 years of that training take the form of the Foundation Programme. That's a 2-year programme where you rotate between different jobs every 4 months, so different specialties in different places, and you can see the jobs I did on my slides over here. I guess I'm showing you those not because what I did is particularly interesting or unique, but really to give you an idea of the variety of work that a junior doctor can be expected to do. You can see there I worked across different hospitals, so I worked in Fife as well as in Edinburgh, and I worked across different specialties. So I did 2 jobs in general surgery and then general medicine, which unsurprisingly is quite general, before doing some more specialist jobs, things like psychiatry, neurology. And actually, what you're doing on each of these jobs is completely different to the last one. So you might well be doing some of the same things, you're still going to be going on ward rounds, things like that, but the types of patients you're seeing are completely different, and some of the things you have to do are completely different as well. Now, wherever you're working as a foundation trainee, there are some similarities, and I think perhaps the most important question to answer here is, what do I actually do all day? And I guess the answer to that comes back a little bit to that question of variety. It's actually, we do loads in a day, and we do loads of different things, which is part of what makes being a doctor so interesting. I've already mentioned ward rounds, and that's something we will do typically. So a consultant, a very senior doctor will come in, and we'll go along on the ward round with them. Often we can present patients, we sometimes have to type as we're going, to make sure that there's a record of everything that happens and a plan that's there. Once that ward round has happened, usually at 8 or 9 a.m, we are left with a list of jobs for each of the patients, which we can then work on in the afternoon. That's the kind of typical day of a ward, if you like. But what those jobs entail can be really completely different. It might be phoning another specialty to get advice on a patient that you've got to look after. It might be speaking to their family about something that's been going on, or even just discussing with a patient about what medications they might want to take or might not want to take, depending on the circumstances. There are some more boring elements to it, so there's things like more administrative tasks, things like rewriting cardexes or writing discharge letters. And I've already mentioned typing on the word round can be sometimes not the most exciting thing to do, although generally it's a really good educational experience going around with a senior doctor. There are a wider variety of things you can do as well, particularly perhaps as an FY2. You'll often get time in theatre, so you'll get time doing surgery, either suturing up under guidance from a surgeon or assisting in the operation. And I certainly did that quite a lot when I was on my general surgery posts. You also work in clinics, so you sit in a room and the patients come to you in an outpatient setting, and generally in that context you then pop through to the next room and discuss it with one of the senior doctors before you come up with a plan. Not all of being a doctor is about being on a ward though, and there's lots of other places you can work. So foundation trainees will go and work in GP surgeries, they work in psychiatric hospitals as I did, but they also take part in lots of other types of work. So things like research can form part of a junior doctor's role too. Things like quality improvement, which is working to make sure that the service you're providing is as good as possible. So they're not directly clinical tasks, but they're still relevant to making sure that patients get the best care that they can. Something that perhaps people don't think of so often is detention under the Mental Health Act. And as an FY2, that's something that you have to consider and you have to do. Depending on where you work, you do that more or less. I obviously did that more in psychiatry than I might have done in general surgery. Teaching is another important part of being a junior doctor. We're still in training, we're relatively inexperienced when it comes to looking after patients, and we still need support and guidance to do that. Often in big hospitals there'll be a weekly teaching session, and often there'll be more informal teaching as well that you can get as you go along. That's not to say that we don't know anything though, and by the time you finish your medical degree you'll feel like you know an absolute load, and actually that means it can be really helpful for you to deliver some of that teaching for medical students. And sometimes actually your level of understanding is much more similar to theirs, and they can get a lot more from being taught by someone closer to their stage of training. Junior doctors work not in isolation, not only with other doctors, but with all the other members of the multidisciplinary team as well. Things like occupational therapists, physiotherapists. Spending time with them, discussing plans together, and coming up with a shared management plan is a big part of the junior doctor's role. So that's an idea of what sorts of things that we get up to. The list is exhaustive and I could have come up with thousands more, but I just wanted to give you a bit of a flavour of it. I guess the next thing is, you do this 2 years of training that's compulsory for everybody, but what is after foundation? And there's a variety of different paths you can take that you can see here. If you want to go straight into specialty training, then you can do that. That's usually around 3 years, and then another 3 years of higher training to become a consultant in that specialty. And we'll hear a bit more about that, the medical route for Morven in a second. Similarly, you can go into GP training, and that takes about 3 years, and Jude will be telling us more about that in a second. Now, not everybody wants to go straight into training, and there are other options available. There's something else there is what I've done. I've become a clinical fellow in medicine of the elderly. So I've taken a couple of years where I'm not progressing towards being a consultant, I'm just focusing on developing my skills and getting ready to enter training. It can be a really good opportunity for people. Some people choose to go abroad to places like Australia or New Zealand or other places around the world and work as a doctor for a couple of years or sometimes more before coming back and then entering training. It's a nice year to have a chance to kind of consolidate your skills and to get used to being in that hospital environment before you launch into specialty training. It also gives you an opportunity to work out what specialty you want to go for. I know some of you will be sitting at home thinking that you're desperate to be a cardiologist or a diabetologist or something else, but actually I think a lot of people don't make that decision until much later on, and for me it was probably last year that I decided I wanted to do psychiatry. I hope that's helpful and it's given you a bit of an insight into what being a junior doctor is like. If you do have any other questions, you can always email advice@youcanbedoctor.co.uk, and I and a team of junior doctors and medical students are on hand to answer those questions. Now you've heard from a junior doctor. We're going to hear from a much more senior doctor next, and that's Morven McElroy, who's a consultant in medicine of the elderly over in Glasgow. And she's going to tell us about her experience of training and becoming a consultant. Thank you.
The next part of that is, so with all those specialties, I'm going to show you a timeline about what you do. And I'm going to focus on physicians because that's what I know, but actually it's roughly the same with whatever specialty you choose to do. So this is just a rough timeline about once you've graduated as a doctor, what you need to do to become a hospital consultant. So, Cal's probably spoken to you about foundation programme, and that's 2 years. And that's the kind of light turquoise blob over at the far end of your slide there. And after your 2 years, you want to kind of start thinking about what you want to do. So every doctor has to do 2 years as foundation programme, and then you have to do core training, and you have to apply for that. So applying for that is through a selective process, and once you get to that, you then do 3 years roughly. Sometimes it's 2, sometimes it's slightly longer, of core training, and you have to sit exams during that process. And for physicians, you have to sit your physician exams. For surgeons, you have to sit your surgical exams. And then there's further selection after that, where you choose to subspecialise. So you do your core training and then you do your specialty training. And for me, that was geriatric medicine and general internal medicine. And that for me took 5 years. In this slide it says 4, but roughly from when you graduate, do your 2 foundation years and then become a consultant, it takes probably another 8 years, 7 to 8 years roughly. And then you come out at the end with your specialist certification, and then you get your CCT and you get something like this. And so once I'd done my 10 years, that took me 10 years to get all of that. I then go on the specialist register for general internal medicine and geriatric medicine. So once you've got something like that, what does hospital training for me look like? So at the moment, you work in various specialty areas. So for me, even though I said I do geriatric medicine, I went through various specialties such as gastroenterology, that's working with the bowels, diabetes and endocrinology, that is working with hormones and diabetes, respiratory, that's chest medicine, cardiology is heart medicine, rheumatology, that looks at the joints and other inflammatory diseases, and haematology. So even though I'm a geriatrician, I had to work through all those different specialties. I also had to work in different hospitals as well. So I know I'm based at the Royal Infirmary now, but I actually worked in lots of different hospitals in the west of Scotland. Some of them you might have heard of, like Westshire General Law Hospital, which was Westshire General, Hare Myers, Stob Hill, the Royal, the Victoria. And then after that, I had to pass my exam still. For me, that was my MRCP, and that was in 3 parts. Two were written and 1 was clinical. And then specialty training, and that took my 5 years. And I got my CCT, that's the certificate that gets me on the register. So what do I do now? Well, I am a consultant in geriatric medicine. I'm an educational supervisor. I'm the lead for widening access to medicine for the board, which is really why I'm here tonight. And I'm also a thing called Honorary Librarian of the Royal College of Physicians and Surgeons of Glasgow. So for geriatric medicine, this is a medical specialty that is concerned with the care of older adults with complex medical conditions. I want to give you a bit of a flavour of what that is. So that basically looks at all different complexities and works around older adults who maybe have falls, a thing called delirium. You might have heard of dementia. In general, those patients are frail. They sometimes have poor mobility, and they suffer from a thing called polypharmacy. It's quite varied. I have inpatients, I have patients in the Royal Infirmary. I have outpatients, so we see people in clinic. I work in community geriatrics as well. So I work with teams in the community looking after older adults. And I also work in some care homes as well. Well, that slightly changed though with COVID at the moment. But what I really like is that it's varied, holistic, and it's real teamwork. I work with lots of different healthcare professionals throughout my week, and no one day is the same. I'm also an educational supervisor, where I supervise and teach trainee doctors. So that involves trainees who maybe have just graduated, so the foundation programme, GP trainees, and also sometimes some core medical trainees as well. I supervise and teach medical students in the University of Glasgow. Not quite like the pictures over in the corner there, but hopefully we'll get back to that soon with less PPE. But I usually teach 4th and 5th years and supervise them. The University of Glasgow is because I work in the west of Scotland. This is the same with consultants elsewhere across the country. And I sometimes teach 3rd years as well. Widening access lead, I really enjoy that as well. As I said, that's why I'm here tonight. And that's how I managed to rope in the next speaker, Jude, who'll be talking shortly. I just wanted to say that there's lots of other things you can do. And in particular for me, I'm involved with the Royal College of Physicians and Surgeons in Glasgow. And I'm a thing called the Honorary Librarian there. So it's just to let you see a bit of flavour of, it's not all about the clinical medicine as well. I get to do other things too. So Honorary Librarian isn't just about the books. It's about the history of medicine, the history of Glasgow and the west of Scotland. And that's something that I find very inspiring and love that part of my job. So I thought that I'd just like to say thanks for listening. I hope you see that how I got here in my career, what doctors work in a hospital, what does hospital training look like now, and what is geriatric medicine and the other roles that I do. And that's just to let you know there's lots of other things that you can do. You're not just a hospital consultant, you get to do lots of other things. So I'm going to hand back to Cal now. I'd just like to say thanks for listening, and I hope you enjoyed Jude, who's coming up next.
Well, thank you to Morven for that insight into being a consultant, so a doctor in a hospital. We're going to hear from the other end of the spectrum next. So Jude is going to tell us about her experience of being a general practitioner. So that's a family doctor of the kind that you've probably all seen before. Pretty much everyone sees their GP at some point. So they really are kind of embedded in the community. And it can be a really interesting specialty that's really very different to working in a hospital. So I'll hand over to Jude now, if that's okay.
Hi, my name's Dr. Jude Marshall. I'm a GP in Glasgow, and I'm here to talk to you a little bit about how to become a GP and a little bit about what work as a GP is like. I thought I'd tell you a little bit about my story first. So I'm one of those really annoying people who always wanted to be a doctor. No matter who asked me or what age they asked me at, it was always a doctor that I said that I wanted to be. This is a picture of me and my sister playing doctors when we were younger, taking turns. I didn't come from a family of doctors. There was nobody in my family who was medical and nobody in the professions allied to medicine. But I knew I always wanted to look after people and take care of people. So I worked really, really hard at school, and I felt that my dream may come true. I had started preparing for my application, and I was working in Marie Curie Hospice in Glasgow every other Sunday, giving out teas to the patients and their families. However, in my higher year, in 5th year, I lost my focus because things weren't great at home. And when I opened up that envelope, yes, we did have to open an envelope back in my day. Unfortunately, I didn't get the results that I needed to go to medical school. I felt at that moment that my future had fallen down and there was no way I would get to be a doctor, and that was all I'd ever wanted to do. However, I got really good advice and I went and did a science degree at St Andrews University, so I did human physiology. So I guess I'm just telling you that actually that first experience of failure for me taught me an awful lot. I wouldn't change it now for the world. I made great friends at St Andrews. I had really great experiences that I wouldn't have had if I'd gone straight to medical school, so I wouldn't change it. And to be honest, it just made me even more determined to be a doctor. So I went to St Andrews University, as I said, and did a 4-year degree in human physiology. Really enjoyed it. Then I came back to Glasgow University and did medicine there. When I joined the medical school, they had just started doing problem-based learning, which is a mature student who'd done a degree already. That really suited me down to the ground. So I loved my degree, and I worked almost full-time in a cafe to pay my way through university. I loved that too, and I held my graduation party in the cafe to say thanks to them for all their support. I got to travel during my medical degree. I did electives in Vancouver and rural Western Australia, and I've just finished paying off the debts for that. So through my university degree at Glasgow, I chose modules and I did electives that were really GP orientated, because I think I knew even at that stage that I wanted to be a GP. So once I left university, I did my own rotation. So again, back in the day, we made up our own rotation. We didn't join a training scheme. So I did jobs in medicine for the elderly, psychiatry, surgery, obs and gyn, paediatrics and A&E. And when I finished those jobs, I got a training position in a practice in Postle Park. That's the third picture that's on that slide. And that was a great year where I just learned so much. It's the most deprived practice in Scotland and really taught me an awful lot and made me even more determined to be a GP as good as the role models that had taught me in that practice. So that's a little bit about me. We'll talk about you guys now. So I know things have changed since I did medicine. I started in 1999, so it was a long time ago. So if you're thinking about GP already, or when you're at university, you could consider joining the Undergraduate GP Society if there is one, or choosing modules that you're interested in, of course, but also maybe have a GP slant to them. Or if you get the chance to do a research project, maybe just considering something that's relevant for GP, or something that has maybe a GP slant on it, or if you take it from a GP slant, that might be helpful. Also, I chose to do my elective in general practice in rural Western Australia in a place called Esperance. As you can see the pictures, it was beautiful. But really, if you don't want to do a GP rotation or a GP elective, just go and enjoy yourself. It's such a great opportunity to travel if you're able to. Although in these COVID times, will you be able to? I'm not sure. So then once you finish university, like everybody else, you would join the foundation programme. This is a 2-year programme, and I certainly know in the west of Scotland there's a few rotations that contain GP as one of the jobs in FY2. If you don't get one of those rotations and you're interested in seeing how GP works or what we do day to day, then you can do a taster week. So that can be arranged through the faculty, where you come out to a practice and just shadow everybody and see how it works. And about this time in your FY2 year, you'll apply for GP training. So the specialty application is called the BGP Specialist Training Application. It's an online clinical test that's testing your clinical knowledge, but also a little bit about your reasoning and your experiences, and asking you about scenarios and what you think is the important way to tackle them. If you score well in that exam, and if you're in the top 5 to 10%, you then are given the opportunity to bid for a rotation that you would like, or a job in an area that you would like. If you're not in that top 5 or 10%, don't lose heart. You then go to a selection centre. At the selection centre, there's usually a clinical test, but also a situational based test where you may play out scenarios with an actor and another GP. If you're successful, then Scotland is obviously one country, but one deanery. So all the GPs are under one deanery, but we're then broken down into north, south, east and west. And obviously I'm going to say west is best because I've done my training there. So then you go on to your specialty training. It's 3 years long, so in total, from graduation to becoming a GP, you could do it in as little as 5 years. Your ST1 year, you will be assigned a GP and a GP practice, and you'll do 6 months in the GP practice in that first year. The other 6-month job will be in hospital. Your ST2 year is 2 hospital jobs usually, and your ST3 year is when you come back into the practice and work full-time for a year. So unfortunately, we all have to sit exams, and there's different ways of doing this for general practice. So we do workplace-based assessment This is watching your clinical skills and your consultation skills develop, talking about difficult cases and how you've handled them. We also ask our patients and our colleagues to do some feedback on how they think we're getting on. The AKT is a multiple choice exam that you sit in the driving test centres. So if you've just done your theory tests, sadly you'll be back in those centres again using their computers for the exam. The CSA was the exam that we sat up until COVID came along. So the CSA is a simulated surgery. So it's 13 patients, you have 10 minutes for each and you're watched doing this, and there's actors who are playing out the role of the patients. At the moment we're recording these consultations and sending them into the college because we're not able to travel down to London. Then once you've completed all your exams and done all your workplace-based assessment, you go to a panel, not in real life, but your name goes to a panel and they decide if you've completed all your training and you're able to get the CCT in general practice. So that's the Certificate of Completion of Training in GP, and you can become a member of the Royal College of General Practitioners. Then really the world is your oyster. There's so many opportunities out there for you. Most people, when they finish GP training, will become a locum. So a locum means a GP who goes to lots of different GP practices and fills in for anybody who's maybe off sick or on holiday or is under a lot of pressure. Then the locums would help out. You could be a salaried doctor. This is where you're employed by practice for a set number of hours a week, and you work regularly with them, but you won't be involved probably in the running of the practice. A GP partner runs the GP practice with their other GPs, and we have a contract with the health board to provide GP services to patients in our area. We run this as a small business, and that allows us to have a bit of autonomy on how we run things, and it allows us to tailor services for patients in our area. You can be a portfolio GP. So this phrase is gaining in popularity. It means you do a mixture of things that make up your working week. I was doing that, and I do that when I was doing my job in Marie Curie Hospice. When I went back after I graduated from the Royal College, I went back and worked in the same Marie Curie Hospice that I had worked in probably 15 years earlier as a volunteer. So I was doing that alongside GP work. As well as that, you could be a GP appraiser. We have an appraisal, so a meeting once a year with another GP where we talk about how the year in GP's gone and what personal development we've been able to do and what education we've done over the year. You can be a GP trainer. So this photograph here is us with our last set of trainees. It's a great opportunity to give back to the next generation of GPs and have an influence in shaping the wonderful GPs that they become. So what do I do now? I work 7 sessions in my practice. I'm a GP trainer, and I also look after about 200 nursing home patients. That's my area of interest. I also work 3 sessions a week for the health board as the lead for anticipatory care planning. Anticipatory care planning is talking to patients about what is important to them, what matters to them, what they want to happen and not want to happen if they become unwell. And I do these other things as well. I'm also a mum to 3 boys who are 9, 6 and 3, and I'm able to drop them off at school and nursery every day of the week, and I'm able to pick them up 2 days a week. So I'm really, really lucky. So why am I a GP? Well, I love the mixture of seeing a child with a cough and cold or skin problems, right through to looking after older people who maybe have diabetes or heart disease. I love that mixture. I love the continuity that it gives me. For example, this week I saw a woman for her 6-week check. So when you have a baby, you meet your GP 6 weeks later, and just to check everything's going okay and how the birth had gone. And I saw this patient who I had seen 10 years ago when she had come in during my first week in the practice. She had a rapidly developing rash all over her body, and I was petrified that she had leukemia, and we sent her straight in. I'm delighted to say she didn't have leukemia, but I recounted this story to her again this week when I saw her. I think she's fed up with me telling her about that story, but I got to tell a new wee baby all about the continuity that I've had with her mum. GPs are also, very challenging, rewarding, lets me use my clinical skills, my communication skills, lets me use the experience that I've gained as a mum, a daughter, a sister, a friend, and from being on the other side of the NHS. I honestly couldn't recommend it highly enough. My day consists of seeing people face to face, or in COVID times on the phone or by video. I also look after patients in nursing homes, which I love. I work really closely with people like Morven in secondary care and with the health board to try and improve the patient journey. I'm also a GP trainer. I love that as well. And all of this work I do is as part of a stable team. We all get on really, really well, work well together, support each other, have a laugh. So I love GP, and I would love for you to join me in GP. If you've got any questions, please don't hesitate to ask, but I'll hand you back to Cal now.
Welcome back. Hopefully this talk will go without a hitch, not that any of them have so far. But this time we're going to be hearing from Callum. He's a final year medical student at the University of Dundee, and he's co-president of Dundee Widening Access to Medical School Society. He's going to tell us a bit about interviews and personal statements. Those are two of the most mysterious things, I think, in the medical school application process. But he's going to work to demystify those and give you some techniques, some hints and tips that will be helpful for writing that personal statement with the deadlines fast approaching. Over to Callum.
Hi everybody, my name is Callum. As already introduced, I'm a final year medical student at Dundee and also co-president of DWAMS, which is the Widening Access Society up in Dundee. And what I'm here to talk to you about is your personal statement and interviews, which I realise can very much be one of the most stressful parts of kind of applying to medical school, in that you've got your grades and you've also done the UCAT, and now you've got this next barrier to compete with. But I'm hoping that kind of what we discussed tonight will put you a little bit at ease. You have a little bit of a better understanding as to what they'll expect and how to kind of tackle these barriers, and hopefully just be much more confident moving forward. So what I'll discuss is, first of all, the personal statement itself and what it is, and also more importantly, what should go into your personal statement, because I realise that some people can really struggle with this. I'll also, for those who maybe haven't actually started writing their personal statement, though hopefully people applying this year have, or maybe people who have started but are maybe just struggling a bit, kind of a key method that you can use for to kind of tackle that barrier. I'll then discuss what interviews are, and then also more importantly, what you probably all want to hear, the type of things that you might actually get asked to talk about, or more importantly do, an interview, and kind of some key tips in terms of how to tackle this. So, personal statement. For those of you who aren't aware, your personal statement you always have to submit for your medical school, and it's 4,000 characters including spaces. Now I know that when I got told this, I don't think anyone really knows what 4,000 characters including spaces looks like, so I've got an image that you can hopefully see on the slide next to you to give you a rough idea as to how much writing you actually have. And the whole point of your personal statement is really to demonstrate your motivation to medicine. You're also going to want to demonstrate what you've experienced so that you have an understanding as to what studying medicine means, and also what it means to be a doctor. And then also an opportunity for you to demonstrate that these skills and experiences you've seen on your work experience and through talking to people, you've actually started to develop yourself through sports and school activities and also just being in school itself. And more importantly, and I think the key word here is reflect, is that they really want you to actually discuss these situations and discuss these experiences and reflect on them, so that they can put themselves in your shoes. So when it comes to thinking about what to put in a personal statement, I always think it's a really simple question to kind of think about is what skills do doctors need? This is in some respects quite a condensed list, and if you write about this into Google, you'll probably get massive lists, and it's always going to have things like leadership, teamwork, work-life balance, empathy, and commitment. And what you really want to do with your personal statement, as we'll kind of discuss and kind of how you can kind of build this in your different sections, is that you want to be able to both demonstrate that you've kind of observed these skills in your work experience. So you've observed doctors and nurses and other healthcare professionals shown teamwork and shown leadership and shown compassion towards patients and each other. And then in the virtual experiences and also your kind of extracurriculars, you also then want to demonstrate that you've started to build these skills. So here's kind of a draft. So this is a personal statement that I wrote for another degree that I started a kind of year or so ago. And this is kind of just a rough idea as to kind of what your personal statement might look like. So quite commonly, what you maybe want to do is start with quite a kind of punchy introduction. So what motivated you to reply? So maybe something happened when you were younger, and maybe there was a kind of life-altering moment or not, as to kind of what made you want to pursue a career in medicine. And this is a kind of really good way to start so that you kind of grab your reader's attention as to why it is that you actually wanted to study medicine. I personally then always discuss work experience next. And what's really important about this work experience, and we'll kind of give you an example as to kind of how to write about it, is that you want to be really specific, and that this is, after all, a personal statement. So what I always want to say to students whenever I help them with personal statements is that you, really want to make sure that the reader can put themselves in your shoes. Because, you know, most people applying can say, you know, I shadowed a doctor and a GP, or I shadowed a ward round, or I did the online work experience that some of the universities are offering. You know, that's very vague in general, and what you actually want to do is you kind of want to discuss specific scenarios and just specific experiences that you yourself have saw, and because then that's what makes it a personal, unique personal statement to you. And I'll show you some examples of that as we go on. Next, extracurriculars, and kind of one of the key things you want to do in your extracurriculars is that all these things that you've listed in your work experience, so you know, you've saw teamwork, you saw commitment, dedication, you then want to actually demonstrate how you've also developed skills in teamwork, and that you've also shown dedication and commitment maybe to your sport or to your art if you do art. You know, it doesn't matter what it is, the key thing is that you're able to show that you're starting to actually demonstrate these skills. You maybe have other interests in personal achievements. You know, maybe you're one of these crazy people who run marathons, and you do competitions and things. So this is also just a little bit about the fact that you are a human, and as humans, we are usually nice, well-rounded people, or hopefully are. You know, we're not all medicine. We do other things. So this is a really nice paragraph to discuss these things. And then again, at the end, what you really want to do is kind of finish off again with a nice kind of punchy statement. You know, you've grabbed their attention with your first paragraph. You give them all this information, and now you kind of want to close it with another punchy statement so that they kind of hopefully remember who it is that you are. So like I said, I'm really keen that you kind of have a rough structure in terms of how you can actually help build personal statements. So normally in-person workshops, I would do this with post-it notes. So this is my virtual post-it notes. And what I always recommend is that you start off really simple and you start off really vague. Okay, and you're going to have your different sections as we just outlined in the structure. So in this example, maybe this student went to a GP, spent some time in a hospital, they spent some time in a pharmacy. And you're going to start these off nice and big and vague. What you then want to do is take each of these post-it notes and you actually want to expand them a little bit further. And this is kind of when you start to bring in that skills list, okay? So an example here, maybe in your GP practice, maybe a patient had just been diagnosed with cancer in the hospital and they were coming in to speak to their GP because they wanted to discuss it a little bit more and they had a better relationship with their GP. You know, by experiencing that and, you know, by observing that, you know, you're able to show all of these skills that you demonstrated the GP having, and that, you know, they're able to be quite empathetic discussing this with the patient. Really good communication skills to discuss such a difficult topic, in addition to also having the medical and clinical knowledge in the background. And what happens is if you kind of start writing these specific scenarios and putting these type of specific scenarios into your personal statement, it really does help, you know, me as a reader, or more so the university as a reader, to actually put themselves in your shoes and actually understand, okay, do you know what, I can see how this person observed empathy and how this person observed communication skills. And I've got a few other examples there. So as I said, kind of key examples here is really what you want to do. And by putting these into the notes, first of all, it kind of helps unload everything out of your mind. You know, if you type it all up into one document, then it can be a bit tricky for it to actually move things about and for it to see what's happening. So I always am a big believer that if you get these things out of your head onto post-it notes or onto paper, then you can actually see it and you can kind of help categorize things a bit more likely. And just like how I've done this with work experience, you would also do a similar thing with your sports activities and extracurriculars, and also with your personal achievements. And you're going to do a similar thing. You're going to write specific examples and specific things. And again, you're going to list the communication skills. You're going to list the teamwork and the leadership. You're going to do exactly the same things, but with all of your own experiences. And what hopefully happens is at the end of it, you've got all of these post-it notes with all your different work experiences and specific examples that you've saw. You've got all of your extracurriculars that you've done and all the skills that you've been able to demonstrate. And then what you're able to do is essentially move them about on a personal statement. And you're able to kind of arrange things as you want them. And like I said, I think it just really helps. And I think what pupils find really useful is that, first of all, they don't actually realise how much they've done. And actually seeing it all in front of them makes a big difference. I think in terms of trying to think about what skills you've observed and what skills you've actually displayed yourself, again, it makes it much easier actually writing it down onto your post-it notes. And then also when it comes to, you're going to be writing numerous drafts of your personal statement. It just makes it much easier in terms of actually moving things about, being able to actually visually see it. So this, I think, is definitely one of the kind of best methods for to tackle writing your personal statement. And one of the best approaches that we always see when it actually comes specifically to writing examples is the ABC approach, which stands for activity, benefit, and course. So something really common, and I've probably read God knows how many hundreds of personal statements, and the amount of people that say things like, I play for a football team, which means I've got good leadership. And they say it really simply and really basic. And at the end of the day, me as a reader doesn't mean very much to me because I don't actually know and I can't really work my way through that. So the ABC approach, your activity benefit course, is a really nice, simple structure to use that you can basically apply to all of your experiences. So as I've got the example here, instead of just writing, I play football for my school team, you can write, my experience as a captain of my school's football team, which is the activity. The benefit is that it's given me an insight into leading a diverse group, allowing for differences in ability and making sure everyone continues to prove and enjoy themselves. That little bit more detail allows me as a reader to actually put myself in your shoes and understand a bit more. And then the course, as in specifically, you're very much spoon-feeding the people that are reading this. You're directing this back to how this actually would help you then be a good medical student. Because from your work experience, you've observed the fact that doctors need this when they work as part of an MDT team with people from different specialties and levels of experience. And that's something I witnessed during my work experience. So this ABC approach can really be applied to any of your experiences. And it's a really helpful way for you, number one, to get everything down on paper. But number two, in terms of tidying up, it's a really great structure for me as a reader to read. And like I said, I can put myself into your shoes and I can actually understand, what this person has learned how to be a good leader. This person does know what it means to be a medical student and to be a doctor. I can actually see this person in medical school. This is a really nice, simple technique that I'd highly recommend everybody uses. So final tip for personal statement. First of all, it is a personal statement. So please do try and actually write about your own personal experiences, things that you've saw, and write about your reflections and how it made you feel. Because trust me, as a reader, it's much better to actually read something that someone's actually kind of thought about and actually discuss their personal experiences as opposed to reading lots of general, vague, and ambiguous personal statements. Don't worry about character count to start with in terms of you're still writing the drafts. 4,000 characters can be really tricky, and I think basically every personal statement that I've ever read ends up at 3,998 characters because it's always very much down to the detail. So don't worry too much about the character count to start with. Just write it down, get everything that you want in there, because at the end of the day, it's much easier to take things out than it is to try and put them in. Get as many people as possible to proofread it. Ideally, people think that you can be a doctor. I think the email address was going about in the chat. If you can get teachers at school, get your parents, whoever, and collate all of that feedback and use that feedback for you to then finish off your personal statement. But do remember it is your personal statement, and it has to be something that you're happy with and that you're okay to send in. And very much, please make sure everything's true, and the reason for which we will discuss in interviews. So, how to prepare for interviews. There's two main types of interviews depending on where you go, which is you've got the kind of more classic traditional panel interviews, which is when you're kind of going to sit at the other end of a table and there could maybe be 2 to 4 people at the other side, and you're kind of with those people for maybe 20 to 30 minutes, and that's who's going to do all of your questions, and that's who you're going to have all of the discussions with. Or what's much more popular now is the multiple minute interviews. So for example, Dundee, when they did their in-person interviews of the previous years, is that you would have 10 multiple minute interviews and they all lasted 7 minutes long, and you literally rotated around them like speed dating, which sounds slightly terrifying, and trust me, kind of going into the situation, it is a bit terrifying, but actually it is considerably more enjoyable, the fact that you've got these multiple mini stations, multiple different people. Essentially, you've got 10 fresh starts to make a good impression, I think is the best way to think about it. So in terms of what they might actually potentially ask you, I'm going to go through these briefly now and then discuss a few of them in a bit more detail. One of them is probably some kind of ethical scenario. And the point of this isn't that, ethical scenarios quite often don't necessarily have a right and wrong answer. And they might have very, very wrong answers that you don't want to say. But the whole point of ethical scenarios in these situations is actually to have a discussion. And the key thing that they want to know is that you can actually maybe give a balanced discussion, and look at things from different viewpoints. The next one would be role play, which I'll discuss in a bit more detail. Personal statement is always going to be a station, which is why it's really, really important that everything in your personal statement is true and that you know everything that's in the personal statement, because you are going to be asked about it. A puzzle station, which links on to the role play that we'll discuss. And then also current topics, which is kind of to assess your kind of general understanding of the medical field. Obviously, what with interviews this year, probably a good chance, trying to find news stories is probably going to be COVID related, but do try to find other stuff. And we've kind of got some hints and tips on how to find things. I think approaching any interview is always really important. And I think one of the things people always forget is basic skills. Okay, so things like listening, so actually show that you're listening. So whether that is really simple things like nodding your head, using facial expressions. When you do answer a question, repeat their own words back to them to show that you've actually listened to them. And you don't forget about non-verbal communication, which is body language. Lots of the times whenever I run mock interviews, understandably you're nervous, even in a mock interview. I've been there myself. It's really easy for you to kind of sit there with your arms crossed. Girls in particular, or guys with kind of longer hair, are really bad at fidgeting and things like this, so maybe they've got their hands kind of tucked under their knees. So these are the type of things, this is where you want to practice, because you kind of want to be aware that you're doing these things, essentially so that you can then stop doing these things as much as you can. And do remember tone of voice in terms of how you reply, in terms of the fact whether you're really excited about something, really sad about something. All of these things actually help form your answer and kind of part of your answer. And as best as you can, try not to fidget. And I think the key thing here is, if you are somebody who fidgets with your hair, tie it up. If you're somebody who fidgets with bracelets and watches, don't wear a bracelet or a watch on your interview day. Okay, so kind of try and realise these things and kind of prophylactically try and stop yourself from doing it on the day. In terms of ethical situations, a kind of really key kind of 4-step process in terms of how to answer these, and I've got a wee example at the side here for you to read through, is first of all, it's always good to present your initial reaction, because you are a person, and as such, as a person, you're probably going to have a viewpoint. So it's always important to present your initial reaction. Make sure you can kind of back it up. Don't just say something and stop, have a bit of a discussion about it. Step 2, though, and 3 are really key in terms of what you want to do is that even if you completely disagree with other people's viewpoints, you still want to be aware that they exist and you want to discuss them. It's really important that you discuss other people's, even if you don't agree with them. And I think this is kind of one of the key things to look for in ethical stations, is that you're able to look at that bigger picture and kind of look at this from other people's viewpoints. And it's always really nice to do if you can, both for yourself in terms of making sure you've discussed everything, but then also for the assessor, is present your conclusion. So kind of very briefly repeat what your viewpoint was, very briefly kind of describe other people's viewpoints, and then again very briefly describe the bigger picture. Okay, so this is a really nice kind of 4-step process. And while I'm not going to necessarily go through these in details, and it's more just something for you to be aware of, we as medical students, we get these jumped into us in first year, or at least we did in Dundee. These are kind of key terms that we use in medicine and healthcare in general, in terms of when we're kind of weighing up ethical situations, in terms of the fact that we want to do good, we don't want to do harm. The patient themselves is a person, or the other person on the line is a person, and we need to respect that. But at the same time, we also need to make sure that we do what is fair for all. So these are just kind of 4 principles for the kind of have in the back of your head. In terms of role play, I think the really key thing here is be yourself. I think especially in this day and age, they're very much looking for a diverse medical workforce. We want people from all backgrounds, it's why finding access, for example, is such a big thing. So just be yourself. You know, you can always tell there's these books that exist, and you can always tell a pupil who has memorized answers from a book, or has, you know, wrote things down beforehand and memorized it. Okay, because you've come across really robotic and not very approachable, and it's really difficult to have a discussion with these people. So just be yourself, you know, however it is that you are, you know, be yourself, and it'll definitely always work in your favour. Whenever you do have role play or puzzles, what will probably happen is that you'll probably have a kind of actor, maybe not so much this year, but I'm sure they will try and find a way to do this online. You know, there'll probably be an actor, who at least in Dundee is usually another student, so they're usually not that far off your age, which makes it a bit nicer. And you'll have an assessor. The key thing about role-playing puzzles is that it is very, very, very rarely that the objective is that you actually finish the task. So let's say you have to complete a jigsaw with your volunteer, who maybe has some kind of learning disability. You know, the point of that task is really never going to be that you actually finish the jigsaw. The point of that task is actually they want to assess, you know, how do you work with your volunteer? You know, how do you communicate with them? You know, how do you potentially help them with the puzzle? You know, how do you get them to help you? You know, you don't want to focus on the assessor, you don't want to look at the assessor or talk to them, unless they talk to you. You know, the whole point of these stations is to see, you know, how do you communicate well with others, and how do you handle problems, and generally speaking, handle problems, you know, as part of a team. So I think the key thing with this role play, very much be yourself, and always focus on your volunteer, okay? And never focus about the task. You know, don't get annoyed because you've only got a minute left and you've, you know, still not built the Lego structure, you've still not completed the puzzle. You know, that's very, very rarely the point. Personal statement station, this is very much a chance for you to expand on your experiences and skills, okay? So this is why it's really important to know your personal statement inside and out. What will commonly happen at these stations, I suppose you won't see it if it's virtual, is that they'll usually have them in front of you and they'll have highlighted paragraphs and sentences, because these are things that they really want to kind of discuss more with you. So just make sure that you do know what is on your personal statement. I've read quite a few where people use medical lingo and medical jargon or discuss specific diseases. Make sure you know what that disease is, because they might potentially ask you about it. They asked me about it because I had a medical word in my personal statement. So make sure you know what it means. You know, typical questions is very much, you know, asking about all those skills I talked about beforehand, about what doctors have and what they hope that you have, is, you know, give an example of teamwork. You know, what would you say is your biggest weakness? You know, someone in your team struggling, how would you help them? Things like this. So it's all very much what's in your personal statement, and it's just a case of picking what's in your personal statement and just expanding on it even more. Okay, and that's where these post-it notes can actually come in helpful for your interview, because you've already got everything written down. So it's just a case of kind of memorising it. So my last slide, and if anyone's got any questions, please do document them and we can answer them later. Final tips, I'm a big fan of people creating packs for your interviews. Okay, so as I mentioned, they might ask for you to have, can you discuss current topics? I would very much recommend just BBC Health News, or the You Can Be a Doctor website also has resources. And, you know, just print out a few stories, okay? Just print them out, have a rough idea as to what these stories are, and take them with you. I would recommend you take a copy of your personal statement for to read on the car journey or the train, just so that, again, it's in your head. Whatever unit is you're travelling to, I would recommend you have a good idea of what their course structure is. So for Dundee, for example, we have the Spiral curriculum, and Dundee loves the Spiral curriculum. So make sure you mention Spiral curriculum if you come to a Dundee interview. And also snacks, be prepared, okay? You're probably going to get there 2 hours early, and if you're anything like me. So make sure you're comfortable and you've got everything you need. And I think the key thing is, remember your basic communication skills, and the beauty of MMI is that every new station is a fresh start. So very much treat it as a fresh start, okay? Don't dwell on what's happened before, just start again. And also never ever be afraid to ask for clarification. If you don't understand the question, as opposed to sitting there awkwardly, not knowing how to answer, it is much, much better for you just ask them, can you repeat that question again? I didn't quite understand. Or, you know, that's actually quite a difficult question to answer. You know, I just need a few seconds to think about it. You know, it's much better to do that as opposed to just sitting in silence. So that's very much my kind of final tips for interview. And very much good luck for the guys who do get interviews, which I'm sure you all will. I'll probably be moving past to the other Callum now.
Thanks to the other Callum. So there's more about all of that, personal statements, interview technique, and everything you need to know to make an application to medicine on youcanbeadoctor.co.uk, including kind of worked examples of ethical scenarios and more information about what the different universities do for their interviews. It's well worth a look if you haven't already. You can also follow us on Twitter and Instagram. You can follow DWAMS on Facebook and Instagram as well, and you can follow Medic Insight Glasgow on Facebook So for the final few talks of the night, we're going to be hearing from medical students at each of the Scottish medical schools. Now there are 5 of those, and all of their courses are slightly different from each other. And it is, I think, a bit of a difficult decision to know which one to go for if you do get offers there. I think what we're going to hear tonight is how the courses are slightly different, and what kind of opportunities you're likely to have at each of the medical schools. I suppose maybe one of the key takeaways is that whichever medical school you go to, you come out the other end as a doctor. And I think that is critical as well. So don't feel too disheartened if you only get offers at one of the medical schools. At the end of the day, you still become a doctor. So our first speaker tonight is Alec. He's from Medic Insight Glasgow. He's going to give us a bit of an overview of what being at medical school is like, and then we'll hear from each of our students in turn. Okay, over to Alec.
Hi guys, time to hear from some more students now. So I'm Alec, a 3rd year medical student at the University of Glasgow and part of Medic Insight Glasgow. We're going to talk to you about life as a medical student. The first half of the talk will be a general overview of medical school, and the second half you'll hear from students from each medical school in Scotland. So as you can see at the top of this slide, there are 5 different schools where you can study medicine in Scotland, and the broad teaching styles are very similar across the schools. So we're going to take you through the different teaching styles you'll come across and explain what they all mean. So before I move on and talk about the teaching styles, I want to tell you about a couple of terms that come up in relation to medical school. So the first is MBCHB, which is an abbreviation for a Latin term that means Bachelors of Medicine and Surgery. And this is the degree you'll graduate with, allowing you to practice medicine. Occasionally, you will see other degree terms, but these are used outside of Scotland. So your medical degree is a minimum of 5 years long. Additionally, all Scottish medical schools give you the opportunity to obtain a Bachelor's of Science degree alongside your MBCHB. And this table shows you what the different medical schools offer and how long the courses are. The president of Medic Insight Glasgow, for example, has just started an intercalated year doing a degree in critical care. And she started this after her 3rd year. So the next term is systems-based teaching, which is used at all of the Scottish universities. This is a block of time, the length can be variable, where you learn about an individual body system. So an example could include the cardiovascular system, the gastrointestinal system, or the central nervous system. And you spend time learning about how this body system works, so the anatomy and the physiology, and what goes wrong with it. And of course, how to fix any problems. So another term is spiral curriculum, and it's a term that gets thrown around a lot, but I actually think, not that many people know what it means. But essentially, over the time at medical school, you'll revisit the same topic multiple times. And each time you revisit it, you'll learn about it in more depth and from a different angle. So, for example, you might learn the very basic function of a body system in the 1st year, and then with a focus on the healthy anatomy and physiology, you might visit it again in 2nd year. Then you might revisit it again in 4th year, where you'll learn the detail of what can go wrong and what healthcare measures can be done to manage those things. And it's actually a very good way to learn because the repetition helps you get all the information into your head, and there is a lot of information. So though every university has their own curriculum, some with more patient-based focus from the 1st year, all of them roughly divide into preclinical and clinical years. So when we say preclinical, we refer to teaching that is based on campus rather than in a hospital ward. And clinical teaching refers to teaching that's on a hospital ward. So I'm going to talk to you about the different teaching styles you'll come across in your preclinical years at medical school. Now, one of the biggest things that's very different is that you are a lot more responsible for your own learning, and this can be very difficult to get used to. But it will set you up with a strong foundation for a career in medicine. The lectures are potentially the closest thing you'll get to the teaching you had in school, Generally, they're about an hour in length and either given by a university staff member or a specialist doctor. You're typically given a set of learning outcomes, and it's your responsibility to take notes and make sure that you learn what you're supposed to, even if the learning outcomes aren't covered fully in the lecture. All universities have lectures, but some of them have more than others. As a general rule of thumb, each of the 5 schools have several lectures, 3 to 5 days a week in the early years. In your clinical years, you're likely to have academic days or academic weeks. And these contain lectures, but you won't have lectures every week. So this table shows you the different types of anatomy teaching that take place across the different Scottish universities. And anatomy, which is the study of the structure of the human body, is a really important part of being a doctor and learning to be a doctor. You need to know what everything is so that you can recognize and describe precisely where something is going wrong. And anatomy labs are actually a very helpful way to get to grips with all this information, especially if you compare it to, trying to learn it out of a textbook. So you typically only get anatomy teaching in your early years, and that's usually year 1 and year 2, and sometimes year 3 at some universities. And there are 2 types of anatomy lab. So there's prosection, which is examining professionally dissected and often preserved specimens, and also dissection itself, where you carry out the dissection. So tutorials are a small group teaching session. The size of the groups vary a lot based on the university and the type of session, and can range anywhere from 8 students to 40 students. They're based usually on academic content, so anatomy, physiology, and pathology, and will support the theme of the lectures and labs and things that you've had during that week. It's a great opportunity to ask questions and discuss things that you're not sure about in more depth and in a more comfortable setting. So there are a lot of different versions of small group teaching in medical schools. Some of these include PBL or problem-based learning, and that's used regularly in Glasgow and Edinburgh. It's quite difficult to explain without an example, but roughly it involves getting together in a group twice a week. The first session is the brainstorm, where you're given a scenario, and the group has to decide on the key issues from that scenario and come up with a bank of questions that they will look up and answer in their own time. The second session is feedback, where you meet with your group and discuss the answers that you found to the questions. You are supported by a member of staff, but they're really only there just to facilitate, and the students do all the work. Another example is case study-based learning, and that's used in the majority of Scottish universities. It's similar to PBL, but you're given a lot more information rather than having to research it yourself. This type of teaching is based on patient case study. And again, you have the chance to kind of discuss things you're not sure about and ask more questions about that case. So practical skills. These are taught quite differently across the different medical schools, but they tend to cover the same things. So you'll learn about communication skills, taking a medical history, ethics, and basic clinical skills such as examining a body system or taking bloods, for example. It's very important for the early years, and it really sets you up nicely for then going on to your clinical placement years later. Generally, you have a session a week of variable length, often led by a GP. So using Glasgow as an example, you have 1 3-hour session every week in a group of 10 students with a GP tutor, and you have that tutor throughout the year. And each week you have different content, and again, it's usually linked to the teaching that you've been having that week. So student selected components, or SSCs as they're known. So an SSC is a block where you get to choose what you study, and it's a chance to do something that you're interested in, and doesn't always have to be related to medicine. So for example, I did my SSC on cancer genetics and targeted therapies in my second year, and this year I'm organizing my own SSC in my third year focused on LGBTQ+ inclusivity and medical education. For your SSC, you may need to do a project, produce an essay, do a poster presentation, or perhaps write a paper, and it is potentially an opportunity to get a scientific publication. There's a variable number of SSCs depending on the university you attend, and St Andrews doesn't offer a formal SSC whilst you're based there, but you do get the chance to choose a dissertation topic in your third year. So in terms of coursework, different medical schools do this very differently. Some have structured coursework every year, whereas some have coursework built into their SSCs and electives. There are a lot of different types of coursework, similar to the SSCs, and they may involve, again, essays, doing a project, presentations, posters, portfolios, etc. As an example, Glasgow, we have the family project in year 2. And for this project, over 6 months, you visit a family with a new baby, and you learn about what it's like to have a new baby, what factors might affect the child's development, and also you think about how this affects the family unit as a whole. So I'm now going to pass you on to Lorna, who's going to speak about the clinical years.
Hi guys, I'm Lorna and I'm in my 5th year at Aberdeen University, so my final year, but I'm originally from a place called Benny. As I'm almost at the end of my medical school career now, only 9 months to go, oh my god, I can't believe it's gone this quickly, I'll be taking you through the latter half of the medical course. So of course, every university is slightly different in that you might get some clinical experience in the early years, some more than others, but on every medical course, your final 2 years are spent on clinical placements, the clinical years. And in my opinion, these are the best years, as you're part of a healthcare team. You'll spend a lot of time in hospitals and GP practices. You'll be rotated down around different medical, psychiatric and surgical wards, GP practices, or even hospices. You'll spend time with real patients and their families. You can talk to them, examine them, and do various procedures. In my clinical years, I've even scrubbed into theatre and helped the surgeons with suturing during procedures. As you're so close to graduating as doctors by that point, you get to pretty much do the job as a junior doctor, but under far more supervision and guidance. A medical elective is a period of study where you can spend time learning about medicine in any country you want to, which gives you an opportunity to immerse yourself in a completely different culture and get an experience of another healthcare system. By this time, you've learned most of the book stuff, so you can apply the knowledge and skills to be helpful in that clinical environment, which is great. The sky's pretty much the limit on where you can go, obviously, other than right now. This is where I had planned to go. This is an island in Fiji, and for those of you that don't know where Fiji is, it's even further than Australia and New Zealand. And so I took it quite literally when they said that, to me, that I could go as far and wide as I wanted to. Unfortunately, it's a touchy subject for me because due to the global pandemic, my electives has been cancelled and I'm staying here right now. But I'm sure this won't be the case when the time comes around for you guys, so please dream big. There are many elective bursaries available that you can apply for to be able to fund your elective, so don't worry about costs at the moment. And also, you've got 3 to 5 years to plan an elective depending on what university you go to. It varies amongst the different universities with the amount of time dedicated to the elective. Aberdeen and Dundee both have an 8-week elective in your 5th year. Edinburgh is 6 weeks in your 6th year, and Glasgow has 2 electives, but it's only 4 weeks, and they're after your 3rd year and your 4th year. St Andrews is slightly different, but you'll hear about them later on. So now I'm going to go into everyone's favourite subjects, and that's exams. Only joking, of course. I've recently just sat my final written exams, and I can safely say that I'm absolutely thankful that they are over. Exams in medical school are very different to most other courses. Of course, we do have written exams, but we also have other types of exams. You're tested on your communication, your clinical skills and procedural skills in an exam called the OSCE, which is an objective structural clinical examination. Here you'll have a certain allotted time to complete a task with the examiner watching you. Out of all the exams, I have to say this is my favourite, as you actually get to interact with the patients and really demonstrate how you've learned to communicate and actually put medicine into practice. Here's me doing a potential examination station. This is me learning how to put a cannula in. A cannula is a tiny tube that goes into one of the veins in your body, and there's a doctor teaching me as well. One final exam you might be able to sit in university, depending on what one you go to, is called an anatomy exam, and here you go into the anatomy labs where specimens or models might be laid out in tables with little pins in certain parts, so you might be asked to identify like an organ or a body or a bone, sorry. Finally, just the MLA, or medical licensing exam, is a new exam that will be introduced for people graduating in 2024. So personally, I haven't sat it, but it will be in place by the time you guys get to medical school. It's a written test that all UK and international students and doctors will have to sit before they can safely practice in the UK. But it's not something you should really worry about for just now, as everything that's in the exam will be taught in medical schools, regardless of what one you end up going to. So, what is being a medical student really like? Well, obviously I can only speak from my experience. I'm sure that if you asked other medical students, they would maybe give you entirely different ones, but I'll just give you a quick overview of what my experience has been like. So firstly, I just want to start off with saying it's a myth that you'll have no free time as a medical student, or you'll be so busy studying that you won't be able to have a social life. This is not true whatsoever, and you've got plenty of time for that. Firstly, I want to talk about the student societies you can get involved in. This is really how you can meet people at medical school or any university course, really. There are things like sports. This is actually me and my volleyball team. Music, art, theatre clubs, charities, outdoors clubs. And there's also so much more in societies, including societies even doing to do with the type of medicine you want to go into. For example, a surgical society or a GP society or paediatric society. I mean, the list goes on. There's loads of them. So you get to meet people that have got similar interests to yourself. The benefit of being a medic is there are often societies just for medical students that are slightly maybe less competitive, and they practice to suit your schedule, but also you can join the wider university societies too. So you've got lots to kind of go on. This is how you meet people with similar interests when you come to uni. You're massively supported as a medical student. When you get to medical school, some universities pair you up with medic parents. This is my medic mum and dad on the left and the right. And who help you when you come to medical school. And actually, you also get paired up with someone in your own year. And interestingly enough, the person I got paired up with in my first year ended up becoming my boyfriend. We've been together for 5 years now. So also, finally, I just want to touch on travelling. So if you can see here, all the little red dots on the map is where all the places I've been in the world since starting medical school. I was doing a research project in Arizona during one of my summers, which allowed me to do loads of travelling. Medical students are encouraged to spend their summers doing internships or research either in the UK or abroad, which is quite a unique thing to medicine, and it's great to build in your CV. So the second part of our talk will be a student for each university, Aberdeen, Dundee, Edinburgh, Glasgow and St Andrews, is going to tell you why they dislike or like their school and why it might or might not be suited to you. So I'm going to start with Aberdeen. Aberdeen, for those of you who don't know, is in the northeast of Scotland. It's a coastal city up here, and we have a beach, but it's very cold in the winter, as you can imagine. I love studying Aberdeen as it's small enough that you get to know everyone pretty quickly, and it has a pretty good nightlife. When you study at Aberdeen, you have all your lectures, anatomy labs and clinical skills sessions in the building here called the Sutty Centre. We're so lucky because all the hospitals and the Sutty Centre are all in one campus called Forester Hill. So it's really, really cheap to be a student here because there's no travelling required. We can literally have a lecture at 9 AM and then head to the ward at 10 AM when the lectures finish. The structure of Aberdeen's course is just here for you to see. I'm sure if you want, you can go back to the recording and look at it later in more detail, but I'll just give you a quick overview. So in your first semester, you do all your basic science, and then once it gets to the December exams, that's you over with. So all the basic science is out the way, which is kind of similar to maybe your Highers and Advanced Highers. But after you come back from your Christmas break, you go on to your first block called respiratory medicine, which is to do with the lungs. And at Aberdeen, we do systems-based teaching. So this is how you learn how the lungs will work, so also called physiology, the anatomy of the lungs, and the pathology, so what can go wrong with the lungs. And also all the clinical skills you need to talk to or examine a person with a lung condition. I think this is the first time you properly get to use your stethoscope, so it's an exciting time for everyone. We also get early clinical exposure at Aberdeen. You start going into the wards by as well after your Christmas holiday in your first year. So you do more systems as you progress through the years, but as you can see, I'm not going to go into all of them today. Just to touch on something Alex said earlier about an SSC, we do SSCs at Aberdeen, but in your third year, you do something special called Humanities, where you get to do something completely unrelated to medicine for 6 weeks. You can learn a language, music, art, politics, economics, or even teaching. I taught in a local high school for 6 weeks, and it was great. I really loved teaching. Final last couple of things. So in Aberdeen, we have a remote and rural programme, which means you must do a placement in Inverness or the rest of the Highlands in your senior years. It's well known that the more rural you go for a placement, the more hands-on you get to be. I went to Invergordon, a place near Inverness, for my GP, and I got to do loads, including even running my own clinics. You can spend the whole 4th or 5th year in Inverness if you choose to. Okay, so hopefully you like the sound of Aberdeen and I've not actually put you off. I'll pass you over to the next speaker who will talk about a different university. Thank you.
Hi there, my name's Minnie. I'm one of the board members for You Can Be a Doctor, and I'm also a final year medical student at Edinburgh. So I'm here to tell you a bit about why you should come and study Edinburgh, just more about the course at Edinburgh. So we have it split up into 3 different phases. So years 1 and 2 are called the Principles for Practice, or preclinical, really, and it provides an introduction into the scientific, sociological, those kind of things, those aspects of medicine, and it's system-based teaching via lectures, PBL, tutorials, and anatomy. We also get clinical skills experience and resuscitation skills, and those are taught in a clinical skills simulation lab. We also have access to GP placements, that's once a week, and that's to learn the basics, things like history taking and examination skills. Our 3rd year, as you've heard a bit about, is the intercalated year, or the honours year, and it's a year out of medicine to study another subject of your choosing. It has to be related to medicine, but that's actually quite broad. So some people choose to do a science subject, some people choose to do a more clinical subject. There's humanities. I actually did a medicine and literature course, which was really great. Some people do public health related topics, and you get a Bachelor of Medical Sciences degree on completion of this year. I think intercalation is a really good opportunity for people who are interested in research, but besides from that, it's also just great to have a year to learn some completely new skills, make some new friends, and experience a bit of what it's like just as life as a normal student. And then our final years 4, 5, and 6 is preparation for practice, and it's almost entirely placement based. You undertake long-term placements and you're essentially learning on the job as apprentices. I agree with Lorna, these are honestly the best years of medical school. In Edinburgh, some of our placements are in Edinburgh and some of them are peripheral placements outside in local hospitals. We have our finals exams in 6th year, and that's followed by electives and assistantship. A few reasons why you should choose Edinburgh. I think that although we might not have loads of clinical time in early years, you do get it right from the start, and you're sort of eased into it with really great support from GPs, allowing you to get good confidence in the basics. As I've said, the intercalated year is really great whether or not you're interested in academia. It's just a great opportunity and something not to be scared of, but definitely worth doing research on, because it's worth finding out if there's a subject for you. I think Edinburgh's a really great city to live in. There's 4 universities here, so there's a lot to do for students, and that's both within the University of Edinburgh and just in the city itself. I think Edinburgh's a big enough city that there's lots happening. You know, we have the Edinburgh Festival every year, which is just really great fun, and especially even better if you already live here. But it's small enough that you can get around by bus, bike, walking, so that's great. And I think we have a good variety of placements. So as I've said, there are big teaching hospitals which are really busy, great for sort of immersive, you know, getting in, getting stuck in, seeing some cool things, but also small district general hospitals, which are really good teaching opportunities, and you can really become part of the team. So that's everything I was going to say about Edinburgh, but I really hope that you enjoy hearing about all the universities, because wherever you choose to apply will be great.
Hi everyone, my name is Sophie and I'm a 3rd year medical student studying at the University of Dundee and also co-president of DWAMS, the Dundee's Widening Access Society. The course structure at Dundee is split broadly into 2 phases: Systems in Practice, SIP, running from years 1 to 3, and Preparation in Practice, PIP, running years 4 and 5. SIP is knowledge-based, covering lots of aspects of the background of medicine. This begins with Principles, which covers all aspects of basic science to provide a stepping stone for learning the body systems. You then, around 5 to 8 weeks, on each system, respiratory, cardiology, neurology, learning the anatomy, physiology, and the diseases which affect that system. This is the core content of years 1 to 3, but during these years you will also attend ward rounds and GP practices. During this time there's a great emphasis on practical and communication skills, which is reflected in our exams, where we have 3 knowledge-based multiple choice exams, 2 OSCEs, and 1 anatomy exam. Following SIP, we move into PIP, Preparation in Practice. In years 4 and 5, you will spend the majority of your time on the wards or in GP practices to gain an invaluable insight into what being a doctor is really like. You progress through a number of blocks which broadly correlate with those you covered in years 1 to 3. In between these two phases at Dundee, you can undertake an intercalated degree. This was discussed earlier in the talk. I will now move on to why I chose to study at Dundee and some things you should know before coming here. After the first 8 weeks of principals, you're almost based entirely at Ninewells. This is the hospital which is in the centre of Dundee. I find this to be a great draw as it means that you become comfortable being in a healthcare environment, so when it comes to your placements you don't feel as out of your depth. Due to the whole medical department being based at Ninewells, the medical school feels like a big community. You form great relationships with our office staff and also the tutors, as you will often see them wandering the wards or waiting in the lunch line. Dundee also has a variety of teaching styles, meaning there should be a style which works for everyone. This includes dissection, mentioned earlier, which provides you with a very in-depth and hands-on understanding of anatomy. To provide a balanced view, it is important to note a couple of things before you come to Dundee. Many students live on campus in the university halls in first year, and this means you require to get a bus to Ninewells every day. Your bus pass will cost around £8.50 per week, which isn't a lot but is worth noting. It isn't a medical student specific bus, but if you're heading in at 9 AM, it'll feel like it. Some people find the patient interaction from so early on quite daunting, but it's what drew me to Dundee. It allows you to learn how to consult and interact with patients early, so when you are based in clinical settings, it becomes natural and you can focus on understanding your patient's condition. We now move on to Dundee as a place to study in general. Although the medical school is at Ninewells, we are a campus-based university in general, meaning the union, gym, sports facilities and accommodation are all within 5 minutes of each other. This means moving around feels safe and has a great student community. But if you don't live on campus, the university provides a bus home in the evening from the library and the union, which means there's no walking home alone and you feel very safe. For being a relatively small city, Dundee has lots to offer. We have many student societies, both medical and non-medical, and if there isn't a society you like, you can always set one up. Thank you so much for listening, and if you have any more questions, feel free to put them in the chat, and we can answer them at the end or at our event on Thursday night. I will now pass you on to Antonia, who will be discussing life at St Andrews. Thank you.
Hi everyone, I'm Antonia. I'm currently a 4th year in Glasgow, but I spent the first 3 years of medical school at St Andrews, and I'm originally from Cumbernauld. So the way St Andrews works is you go there for 3 years and then you transfer on to another medical school, so either any of the Scottish unis or Manchester or Barts in London. I thought St Andrews was brilliant. It's a beautiful place to live and the medical school is great. It's known for being quite a science-based course, but I didn't really feel this. I found it was very hands-on. Your week is filled with practical sessions. You've got full body dissection, loads of clinical skills, communication skills classes. You've also got loads of ethics tutorials and loads of volunteer patients that come in as well. So I thought it set us all up really well for clinical years. The best thing about the medical school is how small and close-knit it is. You'll know probably every student in the medical school by the time you finish, and you'll definitely know all the staff, all the tutors, and all the lecturers and doctors that work there. Their offices are all there. You can go and visit them whenever. The access and support is brilliant, and it makes for a really comfortable learning environment. You do everything in the same small groups for the full year. And we've also got 8 junior doctors who are just finished FY2, and they do all our anatomy and clinical skills teaching with us, so you get to know them really well. They're so helpful in helping you prepare for your clinical years, and it's just such a great way to learn. You're very well looked after in a medical school. You're not left to your own devices as much as you might be at other medical schools. You're quite pampered actually. The online tool for how you get your timetables and all your resources is so simple and easy to use, which you might not appreciate now, but you will once you're at medical school. And right down to everything, like they provide your transport to placements. In return for being so pampered, you do get quite a lot of exams. Each semester you will have a mid-semester and end of semester exam. So I actually did like this. It might sound a wee bit scary, but you always knew where you were. If you messed up a wee bit in the mid-semester exam, you could make up for it in the end of semester exam. You were all studying for one of them, but it really kept you on your toes. The other great thing is there's pretty much no travel time when you're in St Andrews, so you can just pop into the medical school in between lectures. You can go to the gym, out for lunch, look around St Andrews. You're next to the beach. Just a great place to live. And obviously, it's not got as much of a nightlife and stuff as living in a city, but there is lots of lovely bars and restaurants, but it really makes up for it in society events, and everyone will find something that they want to get involved with at St Andrews. One thing that did worry me about going there was would I fit in from my background? I thought it's obviously quite a stereotype about St Andrews, that it's maybe quite snobby, and don't get me wrong, you'll find elements of this across the uni, but I didn't find it at all in the medical school. I found that it was so welcoming and down to earth and just such a great learning environment. And you'll find your place at St Andrews. The more people that go there from different backgrounds, then the better you can make it. And in return for that, you get to go to amazing medical school and live in such a beautiful corner of Scotland. So that's me. That's my talk about St Andrews, and I'll pass you back to Alec at Glasgow Medical School.
Hi guys, it's Alec again from Glasgow. So at Glasgow, the teaching is divided into 5 phases across 5 years, highlighted in the diagram on the left. Phase 1 is the first half of first year, and you'll learn about different topics every week, introducing the body system and what they all do. Phase 2 are larger blocks of 4 to 6 weeks and continue to the end of year 2. Here you take each body system in turn and learn about them in depth. Phase 3 is a 15-week intense block, which I'm in now, and you'll take on each body system or a topic every week. And you learn about what can go wrong and how to approach diagnosis and treatment in that area. Phase 4 is the clinical placement phase. So that runs from mid-3rd year to mid-5th year. Here, you take everything that you've learned in phase 1 to 3 and put it into practice. Finally, there's preparation for practice. In this phase, you'll shadow junior doctors as you begin the transition into your new work role. So, some of the great things about Glasgow. Though clinical exposure is not a major focus in year 1 and 2, you do get the opportunity to work with patients and learn about what's important to their wider care. In year 1 and 2, you're based on campus. So as much as you're studying medicine, it does feel like you're a normal student for a couple of years. Teaching in year 3 is based at the new Queen Elizabeth University Hospital, which is the largest hospital in Europe, and you can see that on the right. Unfortunately, due to COVID, I'm actually missing out on that, but I will be back soon for my clinical placements. The medical school has a large 24/7, when there's not a pandemic, library that's dedicated to medical students, and that's a really great resource. So I actually studied at the University of Manchester before I came to med school, and I can tell you that finding a library place at exam time can be a real pain, so it's actually a very good thing. So one thing to consider when you're choosing Glasgow is that there is a significant degree of self-directed learning. So Glasgow has a lot of PBL, as I talked about earlier. That actually drew me to Glasgow, but I know it's not for everyone. I personally found it's actually a very good way to learn, and I think it's probably made me a better independent learner. Still, a lot of people do find it quite steep adjustment and aren't keen on PBL as a teaching method. But what about outside of studying? Well, the West End, where the uni's based, is really great. There's lots of nice bars, restaurants, shops, and even a small cinema with sofas. As a big city, Glasgow also has a very lively nightlife, from clubs to gigs to comedy clubs, and the day life is also is great. There's lots of museums, galleries, sports parks, theatres, so on. The university has lots of great student societies, both medical and non-medical. It's important, I think, to have things like that outside of medical school, and the Glasgow Medical School actually keeps Wednesday afternoons as free as possible so that you can do other activities. For example, I'm involved in some medical things like Medic Insight, and also some non-medical things like hill walking. So there's definitely something for everyone. So that is Glasgow. So that's it from us students on life as a medical student, and we hope you've got a good overview of what studying medicine involves and the 5 medical schools. Don't forget to submit questions if you have any, and we'll get back to you. And thanks for listening. And of course, good luck with your applications.
So thank you to all of the medical students for telling us a bit more about their experience of being at medical school. And thank you to all of you for listening to all of our speakers tonight. We really hope you found it useful. We've been looking through the chat and we've listed some questions, and we're going to go through them after a short break, but I appreciate it's coming up to 9 o'clock, so if you do need to get away, then that's fine too. If you'd like a certificate to say that you did come to the event, then all you have to do is fill in our survey, our feedback survey that we'll be sending out to you just shortly. We'll come back with some questions and we'll hear from some of our speakers again about some of the specific things that you've asked as we've gone through the live stream, and that'll be in about 5 minutes or so. Thank you. Welcome back and thanks for sticking around. We're going to go through some of the questions that you guys have asked in the chat over the course of the night, and we're going to cut to different speakers who are going to give their take on it. We promise we won't take up too much more of your time. It's going to be a relatively short answer for each question, but it's really just to get some of those kind of personal questions answered as best we can. Worth remembering that there's more on all of this on youcanbeadoctor.co.uk, including a wide variety of videos and information on everything from interviews to personal statements. Now our first question is one that we've touched on before, and one that I think is really important to consider when you think about applying to university or becoming a doctor. And really the question is about whether or not you have enough free time as a medical student to do the things that you enjoy. I think it's a difficult question, and I think it maybe varies a wee bit depending on how close you are to exams. But we're going to cut to Alec now, who's going to tell us a wee bit more about his take on it.
So, I mean, medicine is definitely an intense course, and it is more intense than other courses. So you can't expect to have as much free time as other students around you. But I guess what I would say is learn how to organize your time. That is really important. But you will have free time if you stay organized. Speak to your medic parents, speak to other students, see how they're working, see what they're doing that works, get your Google Calendar, your diary, whatever, plan things out. And my personal tip, because I can be a bit of a workaholic, my personal tip is try to commit to some things like sports, so that you actually force yourself to have time outside of medical school and force free time. I don't know if that's a thing, but that's what I do. But there is time. If you stay organized, you can definitely find time.
Thank you to Alec for that explanation. Our second question is about some of the different specialties you can do once you've graduated from medical school. There's a whole range and you can apply in lots of different ways. But in particular, this person wanted to know, are some specialties more competitive than others? And if so, which are the most competitive?
We've lost Morgan's camera.
We're going to pause for just a second because I think the camera's not quite working for the person we're going to go to. So we're going to go on to our next question, I think, if that's all right. And we're going to hear from Callum from DWAMS. Again, I think an interesting question, quite an insightful question that we've had tonight. What's the biggest mistake that people make in their applications? Now, it's a difficult thing. The application process is pretty long. It goes on for quite a long time. There's lots of different elements to it. So I think that's a tricky question to answer. But we're going to hear what Callum has to say just now.
Okay.
Okay. So I got asked specifically about what makes a bad application. So in terms of personal statement, I think the first thing to remember is that, Dundee, for example, gets about 1,600 personal statements, gets 1,600 applications. So I think what makes a particularly bad personal statement is just the very vague, general, kind of cliche. And, this is why I kind of try to emphasize the point that it's a personal statement, which is why you want to write down those personal experiences and you really want to spell it out for the reader, using that ABC approach. In terms of interview, I think the key thing is people who don't prepare, and I think this will be particularly important this year in the fact that it is probably going to be online, which will be a very new scenario. So I think the key thing is very much prepare. set up with friends, set up with family, set up with teachers if you can, to do mock interviews. And again, kind of like the personal statement, and what I try to emphasize is be yourself. You know, assessors know within a split second if you have a rehearsed answer, if you've memorized something from a book, you know, if you're just saying what everyone else is saying. So, you know, give personal responses, you know, just be who you are. And do make sure you prepare, especially this year if it's going to be online, get used to talking in front of a camera, because it's very, very bizarre and very weird. So I think that would be my key tips in terms of how to make sure you don't have a bad application.
Thank you to Callum for that explanation. I'm going to answer the next question myself. And it's maybe a difficult one to answer in this kind of setting. It's what are the main challenges? What are the main negative aspects of being a doctor? I think to be honest, we have to say that there are some negatives. We often have to work quite long hours. We often have to work quite a lot. I think even at medical school, we have slightly, well, maybe not harder exams, but we have more frequent exams right from the very start. And it is perhaps a slightly larger workload than other university courses. It doesn't mean you don't have any free time, but it is something you need to bear in mind. I think once you start work, and I spoke about in my first talk about kind of that first moment when you're on the ward by yourselves, and suddenly you've got these patients to look after and you're responsible for them. I think the reality of being a doctor is that sometimes bad things happen to those patients, and sometimes bad things happen that you can't really do very much about. Now, as part of what my job, something I find quite rewarding is palliation. So that's making sure that people are comfortable in treating their symptoms, whatever setting they may be in. Now, that is not everybody's cups of tea, and unfortunately, some patients do pass away. That's something you have to bear in mind and you have to think about when you're going to become a doctor, because it's something you will deal with on a day-to-day basis, whatever specialty you go into. I think one other thing to think about is that as well as being a great opportunity and allowing you to do all sorts of different things, there is a level of responsibility associated with being a doctor, and that takes lots of different forms. So we're perhaps a little bit more than other types of job. I don't stop being a doctor when I leave the hospital. If someone collapses in the street, I'm duty bound to help them, and even within the hospital, it means I can be responsible for lots of different situations. If you've got two emergencies going on at the same time and you're the only doctor, you've somehow got to split yourself in two to try and manage those. Now, the systems are much better these days than perhaps they used to be, and there's a lot more support available for junior doctors now. So I can't say that's been a major issue for me, but there are certainly difficulties and some things about being a doctor that aren't for everybody, and they can be hard to deal with. So those are the sorts of things, actually, sometimes it's really useful to get some insight into for your personal statements and for your interviews. And hopefully talks like this will help you to do that. Okay, we're going to go to our next question now. And I think we're going to go back to the one I just tried to, which is Morven. And that was a question about some of the medical specialties after you finish the foundation training programme, when you go a bit further into your training. And that is, are some specialties more competitive than others? And if so, which is most?
Hi, so firstly, I'd just like to say thanks for all the amazing questions that we've had in tonight, and some of them have been answered already. But from my point of view, looking at specialties in which are competitive, one of the things you can look at is the competition ratio, and that looks at the number of applicants to each post nationally. Actually, that waxes and wanes over a few years and isn't always accurate, and there are huge variations locally. So I think that actually what you need to do is, once you get into being a doctor, think about what you want to do and train for that. Decide on what specialty you want to go into and work towards that. Get your portfolio right, work towards things that you can do. Any job you do can be linked to the specialty that you want to do. So just have a hard think about that. The other part is have a plan B. I think for me, I was really lucky. I always wanted to do geriatric medicine, so I knew it was pretty straightforward. I applied to medicine, sat my exams, and then did my specialty training. But always have a plan B. And that's all I can really say. You can Google the competition ratios if you want. They're freely available each year, but that doesn't tell the whole picture. I think you need to decide what you want to do and go for it. Thanks.
Thanks to Morven for that. So our final question tonight is one quite applicable to people still at school, I think, and it's a question about taking a gap year before medicine. So we're going to hear from Antonia about whether or not that's a good idea.
Hi again, everyone. So my question was, is taking a gap year a good idea? And my answer would be yes, I definitely think it's a good idea, although I didn't want to take one. I didn't really have a choice. I didn't get in anywhere the first time, but I definitely say if that happens to you, don't be disheartened. I wouldn't go back and change it now if I could. It was the best thing that I've done. On my gap year, I worked full time as an auxiliary nurse or a healthcare assistant, whatever you want to call it, in the Queen Elizabeth Hospital in a really busy care of the elderly ward. I was terrified when I started, but it taught me so much, taught me how to speak to patients, to speak to their families, to care for them, to be stressed, to do night shifts, and how to work in a team. I use what I learned there all the time. I think it's made me a better medical student. People on the wards, especially everyone who's not a doctor, really appreciates that you've got that experience and you know who they all are and what they all do. So if you do have to take a gap year, I would recommend that you try and get something really hands-on, a caring role. It will teach you so much about getting to know people and how to find out what's important to them and how to look after them. And it's given me an extra skill. I now work as a home carer alongside medical school, so going into people's houses and looking after them. So that allows me to work as well as be at medical school, and that is a great experience every day as well. So yeah, if you have to take a gap year, don't be disheartened. It could be the best thing that's ever happened to you. It'll give you so many skills and so much more confidence for going to medical school. And yeah, go on holiday and stuff as well, but try and get into the hospitals if you can. So that's my answer to that question.
Thanks, Antonia, for that explanation. That just about wraps up the talks tonight. I really hope you've enjoyed it and that you've got something from it that you can potentially think about using in your personal statement or even in your interviews. I'd like to thank all of our speakers tonight. We come from a wide variety of organisations. I'm a trustee of You Can Be a Doctor, but we've also had speakers from Dundee Widening Access to Medical School Society, Medic Insight Glasgow, and Medicine Outreach Glasgow Widening Access Initiative, or MOGWI. We've really worked hard to bring this to you, despite the challenges that the pandemic has brought us. We're much more used to doing this kind of thing face to face, and you might have been able to tell that from some of the stream difficulties that we've had. I do apologise for those. We promise we'll be better next time when we do our next series of talks. Remember, if you want a certificate for attendance, you need to fill in our feedback survey, and we'll email that out to you just probably tomorrow, but perhaps shortly after this event. Remember, if you have any other questions that we haven't answered so far, you can always email advice@youcanbeadoctor.co.uk, and we've got a team of doctors and medical students ready to answer those questions. There's loads more information on youcanbeadoctor.co.uk as well, and each of the organisations I've mentioned has social media as well, so you can follow us there for more hints and tips and updates and advertisements for our next event. You can tell it's been a long live stream because I can't talk anymore. Thank you very much to all of you for coming. I really hope you've enjoyed it. Do let us know how you found it. And we're going to end there.